Welcome to Oak Leaf Surgical Hospital. We look forward to meeting you for your upcoming surgery. In this video, you will find useful information for you and those helping to take care of you when you are home. Some items we will cover in great detail, and others you will be just introduced to, as they will be covered in more detail during your stay. If you find you have questions about home safety, equipment needs, or the ability to manage the post-operative routine, we suggest that you speak to your physician about a pre-operative physical therapy visit. At that visit, a physical therapist can educate and assist you in getting your discharge planning for home all taken care of, including a walker, crutches, bathroom equipment, and to teach you your exercises. Some individuals also need extended stay at a rehab facility to gain independence. Please speak with a discharge planner at Oak Leaf Surgical Hospital regarding this. The more you are educated and prepared, the smoother the hospital stay and rehab at home will be. With each session of physical therapy at the hospital, you will practice a series of exercises. These exercises are meant to build up your strength and prepare you for the next phase of exercises that comes during outpatient physical therapy. We recommend that you attend physical therapy when you leave the hospital to help complete your rehab for strength, range of motion, balance, coordination, and community activities. We want you to get back doing everything you want to do. We are going to do your knee exercises. So these are exercises you're going to want to do 3 times per day. And I'll get you a handout to take home so that you can practice them all just like you learned here. So the first thing I'm going to have you do is I'm going to have you pump your ankles up and down on both sides. So I'm going to have you bring your ankles all the way up and then down. Yep. And you can relax your legs up here. Yep. Just pump those ankles up and down. You want to pull them all the way up till you feel a stretch, and then point them all the way down like you're stepping on the gas pedal. One more time. This exercise, the nurses will ask you to do a bit more often as well because it helps to reduce your risk of a blood clot and also to reduce your swelling. So this one we do recommend that you do a bit more often than the 3 times per day. Up to every hour that you're awake, you can do 10 to 20 repetitions. All right. Next exercise is going to be for the quad muscle on the front of the thigh. Now I know this is going to be a little sore, your incision is there, probably a little swollen, but I want you to try to tighten up this muscle and push your knee down into the mattress, and then I want you to relax. And I want you to push down and relax. Yep. Push down. A couple more times. There you go. Oftentimes this exercise gets a bit easier with each repetition that you do. So sometimes the first few are a little difficult, but this one gets better. One more. Excellent. All right, the next exercise that we're going to do is called a straight leg raise. Now this one you might need a little bit of help with, and to make it a little bit easier, I'm going to have you bend up your non-surgical leg. So your good knee, I'm going to have you bend that knee so that you get a little leverage and that you're being safe to your back as well. So I'm going to help you with the first few, but I want you to tighten the muscle, and then I want you to lift that knee just a couple inches up and then down. And then relax the muscle, tighten the muscle again, lift and lower. And you don't have to lift much higher than that. Yep. Good. And have you do one more. Tighten that muscle first. Lift. There you go. You want to try to keep the knee as straight as you can. I understand that when you're weak and feeling pain, it's hard to keep that knee straight, but just do your best to keep that knee straight. The next exercise we're going to use this coffee can for. You can take this coffee can home with you so that you've got it at home, but I'm going to have you just very carefully bend that knee up a little bit, and I'll help you. And slide that coffee can under the knee. And this exercise is meant to straighten and bend the knee. This is called a short arc quad. So what you want to do is you want to straighten your knee, lift that lower leg, and then bring it back down. And pause, and then straighten. Let's try a couple on your own. There you go. Try to get that knee straight at the top if you can. Yep. Bring it down, let it relax, and then go ahead and do one more. Very good. When you're done with that one, you can use this same coffee can and we're going to pull it right down to your ankle and we're going to work on straightening your knee. So we're going to lift up that leg, put it under the ankle, and you're going to want to just let that knee straighten. At first, you might need someone's hand underneath that knee just to kind of help feel it a little bit more comfortable. But as time goes on, let that knee go, let it just hang there. And if we can, we're going to spend about a minute here, letting the back of that knee stretch out. For some patients who have a more difficult time, we have to go for 3 minutes, but we'll just go for 1 minute right now. And the important thing is to tell your knee to relax and tell your hip to relax so that the leg is just laying there. All right, let's lift that leg up, get that coffee can out of the way, and let your leg relax. We have a few exercises left to do. The next exercise is called a heel slide, and I want you to bend your knee and slide your heel on the mattress. So you're going to go ahead and bend your knee, slide your heel. You'll probably feel some stretching through here, and then straighten it back out. And then go ahead and bend. And each time you might notice that you're able to take it a bit further. And if you can, go ahead and move it into that increased range of motion. You'll hear the doctors and the physical therapists and the nurses ask often about range of motion. And this is one of the keys to knee surgery recovery, is to get that range of motion back so that you can do whatever you want to do. So this kind of stretching is what's going to get us there. Now at home, if you're at home doing your exercises, if you have to have someone help you, that's fine. If you need to sit up and use your hands behind your thigh, you can do that. And outpatient therapy will teach you some other ways to do this as well. Good. One more time. Good. Straighten out. Perfect. All right, we've got one more exercise left to do, and we're going to do that sitting at the edge of the bed. So we'll help you get to the edge of the bed. So for getting to the edge of the bed, what I'll have you do is I'll have you start to scoot your body to the side. So bend up your good knee and scoot your hips over, and then bring your surgical leg over a little bit if you can. Yep. Can you scoot one more time? Okay. Then you can bring your surgical leg, or non-surgical leg, sorry, off the side and start to pull that body up. Bring this leg over, and you can help with it too if you want to. Yep. And then just let that knee bend as you get over the side. There you go. And drop that leg down. And you probably feel a lot of stretching there, but that's a good rest position for you to be in when you come into sitting. And for this exercise, I'd like you to go ahead and at your knee and using your quad muscle here, I want you to go ahead and kick that leg out and then bring it back down all the way. Yep. Go ahead and kick it out straight. Bring it all the way back down. One more. Good. And let it relax. Now, we talked about bending your knee, doing your heel slide exercise. It's also an option when you're sitting in a tall chair, in a stool, or maybe your bed at home doesn't have this handrail in the way. You can actually pull your knee back into that stretch, okay? So sometimes when you feel like you need a little bit more stretch, use that space and pull your knee and pull your heel back. And this one we have to modify kind of as your knee progresses. That's good. All right, we are going to get ready to go for a walk. So we are going to use this front-wheeled walker. We're going to get you one like this for home, or maybe you already have one, but this is going to be your best mechanism for getting around. So when you go to get out of bed, remember that you can put as much weight through your knee as you tolerate. Pain is your guide. It's called weight bearing as tolerated. So I'm going to have you scoot forward a little bit so that foot's on the ground. Yep. And then you're going to push up hard with your surgical leg. And actually, I'm going to have you put one hand down on the mattress and one hand on the walker. There you go. And then you can stand up. All right. You can straighten out that knee just a little bit. There you go. Now you're going to move the walker forward. I'm going to have you move your surgical leg first. Yep. And then your good leg. And then the walker. And try to land on that heel. Straighten out that knee just a little bit more. Yep. There you go. One more. Very good. We are going to use these crutches. Now, crutches are an option as well as a walker. You can choose to use the crutches as much as you want. Some people use them just in tight spaces, bathrooms, but I want you to know how to use them. When we stand up, we're going to get them adjusted and make sure they're the right height for you first. So keep both crutches together on that side, and I'm going to have you go ahead and push up. Yep, and I'm going to take the outer crutch here and get it under your arm. And then let's get this one under your arm. There you go. All right, stand up nice and tall. You want there to be a little bit of a space in between your armpit and the crutch. You want the crutch to press against your trunk, not up into your armpit. And you want to have a little bend in your elbow so that you can use the leverage from your arms. So I'm going to have you go ahead and move the crutches forward, surgical leg forward just so it's in between the crutches. Yep. And then move the good leg forward, crutches, surgical leg. And one more, and I want you to try to land on the heel when you land on that surgical leg. Pick that leg up, land on the heel. There you go. That is the best way. Very good. When it comes to your mobility, we have many options for getting around. There are walkers, there are standard walkers, there are front-wheeled walkers, and we want to make sure that you have the right item for you. So in front of you, we have a walker with just wheels on the front, and this is called a front-wheeled walker. There's also walkers that just have the 4 standard posts that you have to pick up and step, pick up and step. And then they also make walkers that have 4 wheels on them with the seat and the handbrakes. Those are a little too loose and they tend to get away from patients, so they're not the safest early on in your rehab. This option here is probably the most fluid, most convenient to get around because it'll roll from wood surface to carpet and different surfaces that might be in your house. So let's practice your walking here. What I want you to do is I want you to push the walker forward. Oop, don't get my toe out of your way. Move the surgical leg and then the good leg. Push the walker forward, surgical leg and good leg. And you want to try to use that knee bending and straightening. So you want to try to land on your heel with a straight knee. And then during the next step, so push your walker forward, you want to roll off your toe, bend your knee a little bit, and then land on that heel again. So you have to remember to bend and straighten at that knee. Otherwise, your knee is going to stay awfully stiff.
Don't forget.
Yep, that's okay. There you go. One more step. Good. Crutches are an option for you as well to get around, and some people find these convenient to have crutches maybe upstairs and use their walker on the main living area, or to use the crutches in a smaller kitchen or a smaller bathroom. So we want to make sure you feel comfortable with these as well. So with the crutches, what I'm going to have you do is I'm going to have you move the crutches forward, just like you move the walker forward. Then you're going to move the surgical leg forward. Yep. And then bring your non-surgical leg forward. You're going to move the crutches, bring the surgical leg and the non-surgical. And you're doing a good job of bending that knee. You want to make sure you land on your heel, and then you want to roll off your toes, bend that knee, land on your heel. Yep. And try to keep that knee bending and straightening during your entire walking pattern. Great. All right, when it comes to practicing stairs, a lot of people have a lot of fear of doing the stairs, and you don't need to be fearful. We will teach you how to do them, and we'll teach you how to do them one step at a time. So what we're going to practice first is using a rail and one crutch. This is probably the safest way to do it because the rail, of course, is nice and sturdy. So if you don't have rails, on the stairs that you need to use on a regular basis, I would suggest getting someone to install a sturdy rail so that you have more independence, not only getting in and out of the house, but maybe getting up to the main living area or to a bedroom you want to be able to use. So do be sure that if you want that, you have that rail installed. So the pattern here is going to be that we are going to go up one step at a time. So we are going to go up with your good leg first. So lift your good leg up onto the step. As you stand up, your crutch is going to come up onto that step, and then your surgical leg is going to follow. Yep. Then you're going to go up again, bring your crutch up, and then your surgical leg. Good, good. Now just walk across this platform for me. And for coming down, you're going to go down with your crutch first, then your surgical leg, then your good leg. Crutch goes down first, surgical leg, good leg, and then you can go down one more step. And at this point, someone can give you your other crutch, or you could have your walker waiting for you, and then you could take off to wherever you want to go. There will be times when you may get somewhere outside of your home that there is no railing available. So doing stairs with two crutches is an option as well. So the pattern is the same, you just don't have the rail to help you. So you want to go up with your good leg, push up and get your crutches up to the step. Yep, it's a little tricky. And then get your good leg situated, okay? You're gonna go up with your good leg. Yep, push up, get a crutch up. Yep, other crutch and surgical leg. All right, go ahead and walk across this platform. So for going down, you're going to go down with both crutches. Surgical leg is going to go down. And then your good leg. Crutches, surgical leg, good leg. One more time, crutches, surgical leg, good leg. All right, getting into the bathroom is one of the things we want to be able to practice so that you can be comfortable at home. Now, we took a standard toilet and we put a commode over the top that has handles on both the left and the right so that you have a nice sturdy place to be able to set down. You can use rails if you have them in your bathroom. You could use a sturdy piece of furniture like a vanity, but this is really probably the best way. So once you're ready there, I'm going to have you reach back to the commode handle with one hand. Yep. Start to lower yourself down, and then you can bring this hand back. Lower yourself all the way down. There you go. And then you can get that knee more comfortable once you're sitting down. And then to stand up, you're going to want to put that leg out in front of you just a little bit, maybe not quite that far. There you go. I would put one hand on the walker. Yep. And then push up with that good side. Pull that leg back underneath you. There you go. And then you should be all set. You will find in your joint venture handout that there will be a lot of information regarding shower equipment. Some people have walk-in showers or stall showers. Other people have the traditional tub shower combinations. What's going to be important for you is to look at your house and see how much equipment your bathroom can tolerate from a size standpoint. They make tub benches. They also make extended tub benches that can sit with adjustable legs on the bottom of the tub, the bottom of the shower, or partially in either option. A lot of times, if people aren't sure what to do, your best person to talk to is going to be your local physical therapist that you're going to be working with after surgery. They can help navigate the equipment that's available, where it can be rented or purchased, or sometimes even borrowed through community loan closets, and help get that adjusted to make sure that it fits you from a size standpoint and also fits well within your bathroom. We want to practice getting in and out of your car so that you have independence, not only going home from the hospital, but also that you can get to and from your physical therapy and doctor's visits. You're going to need a driver to pick you up, and you'll also need someone to drive you for the first few weeks. But we're going to teach you how to ride in the passenger seat of this car. So let's walk right up. You're going to want to walk towards the seat. And as you get closer to the seat, go ahead and turn towards the door. Nice small steps. And back up to the car. You're going to want to go ahead and reach for the seat. You can use the door handle and the console. Sit on the edge to start, and then you're going to want to start to scoot yourself in. Now, if I pull your walker away, I can assist at the leg. Go ahead and you scoot your body in. Yep. Bend your knee and bring it around. We've also moved the seat back and reclined the seat to make it easier to rest the leg. So for getting out of the car, you're going to want to go ahead and assist your leg. Use the seat and the door frame and the console until you get the walker situated, and then you can boost yourself out of the car. Hopefully the information you've gained here today has been helpful to you and your family members as you prepare for your upcoming surgery. If you have any questions regarding any of the information, please reach out to one of your providers. On behalf of Oak Leaf Surgical Hospital, we wish you the best for a speedy recovery.